I'd like to introduce our moderator for this panel, Dr. Heba Barakat. Yes, Heba is a senior manager of the healthcare programs at the American University in Cairo School of Business Executive Education. Dr. Heba graduated from the Faculty of Medicine at Cairo University and obtained a master's degree in pediatrics from the same university, then a PhD in pediatrics from Shams University. Also, she obtained a diploma in hospital management and a diploma in total quality management in healthcare from the American University in Cairo. Heba has worked in the healthcare field for almost 30 years with different hats in both public and private sectors. So perfect for the moderator of this next session. Please.
Good afternoon, everyone. Thank you, Nicole. It's a pleasure and honor to be with all of you today. Let me first introduce and invite our respected panel members to join us on the stage. Magda Rosenmöller, Professor and Academic Director, Center for Research in Healthcare Innovation Management, IESE Business School, Spain.
Yes.
And Timothy Okech, Dean Chandaria, Chandaria School of Business, USIU, Kenya. I believe we all agree that we are living in a wonderful, amazing, innovative world with full of breakthroughs every day. Now we have the 3D printed houses, and we have the exoskeleton workers who are helping and lifting heavy things. And we have this self-driven vehicles. So we are living in the technological revolution, which is affecting all the industries, including the healthcare industry, of course. But are we ready for this? Let me share with you something that touched me strongly when I read it for the first time. I'll paraphrase Dr. Bertalan Misko, the director of the Medical Futurist Institute. Imagine with me in the near future, when we land on our neighboring planet, and the pioneers in their spacesuit, advanced spacesuits, they are experiencing a feeling they never experienced before. And all of a sudden, with no definite reason, they have a problem. They can't see well. So they are asking for medical support. Unfortunately, on Mars, there is limited resources and facilities, and their case has been managed remotely. They have no say in this. They feel abandoned, lonely, dark inside out, because again, they lack the care and empathy they deeply need in this moment. This scenario that's happening on Mars is happening on Earth every single day in the developing countries. And it happened in the developed ones as well during COVID-19 crisis. So to solve the problem on Mars, we have to act on our problems on Earth first. And this is why goal number 3 of the SDGs has been developed. Good health and well-being. Because SDGs are universal call for better life and prosperous life for the human beings. And health is lying in the core of this. We can link health to all other SDGs, because the healthcare ecosystem is affected by many factors: political, social, environmental. All these determinants are affecting the healthcare system. In our session today, we will cover the leadership, the healthcare leadership needs, potential, challenges towards achieving the 2030 vision, and the role of business schools to be the change agent towards this achievement. We will start our session with 5 minutes presentation by Magda, and then our discussion will kick off. The floor is yours, Magda.
Thank you. describe this. Thank you. Yeah, I think great you made this reference to the changing world, and I think we have seen the world stood still. No, we have seen this with the COVID crisis, that we had a substantial change, no, to virtual learning, in our case as educational, but also to telemedicine and virtual, which is advantages and disadvantages. And I like this picture out of the film by Ai Weiwei, because these are these high-speed trains. They stand still, but then actually they move, other things move and get accelerated in terms of change. A lot of new technology, and we see this gap. This is a McKinsey report from 2010. Even now, with the COVID acceleration, this gap is increasing. The role of business schools, as you say, in managing this technology. This is an example of prescribing digital therapeutics that we did with general practitioner, with the Royal Academy, the Royal Chamber of General Practitioner in the UK. So here, as business schools, we are working with professionals to use these new technologies. This is how AI can be used in the health sector, in the medical environment, another role that we can have. And then the ecosystem. We know that technology is changing the ecosystem, and particularly in healthcare, we have the health ecosystem. This is a simulation we created together with all the stakeholders. We had the multi-stakeholder panel just before us, is like really bringing all the different stakeholders around providing high value care. Another point I want to make, so one is the needs-led and value creation. Then is the how can we understand the need, the innovation need. This is like the Stanford Biodesign. There are a lot of programs around Europe that are adopting that, and with business schools can support this needs-led innovation that is this emergent into the reality. And then another example, the patient-led innovation, and Nova Business School is very much involved in that with Pedro Oliveira, where we can help to see what the patient needs that they bring to the table. Then the needs of professionals. This is a program we did with women innovators and with executives, where we started by asking them, what are your needs in terms of managerial capacity building? And this is the global innovator, the global health innovator. Again, we brought them together to understand the needs. So that would be a second point I'd like to make, needs-led education that we should do. And we have worked on this with the Genie framework that Reggie Hertzlinger from HBS had put on the way, where we did a lot of meetings around what is our role as educators, as managerial educators in global health. And we continue to do this in part of the Business School Alliance for Health Management, where we bring faculty together, where we bring alum together in order to drive that. A lot of common business schools that we had with GBSN, and actually the idea is actually to see how we can build on this with GBSN. We had a very good session yesterday with those business schools that are interested in healthcare, and see how can we build on that in change between faculty, change between alum, helping students to immerse in different realities in different countries. So that's definitely also a role that GBSN can take up. And I wanted to finalize with these. The colors of gratitude is in the metro station in Barcelona, the thanks to health personnel, and also to the drivers, the people from the transport company. And it's a huge mural where we have the different hospitals, and it's 2 years there and it has yet not been touched by. So I thought it was a nice way of ending. Handing back to you. So I raised a few issues I think that are very important in healthcare and in the role of business schools. Thank you.
Thank you, Magda. So we will start our journey again from the patient, from the healthcare. So how can you define the healthcare leadership skills that needed, and is it different from the leadership needs in other industries?
I think, yeah, that's a very good question. I think healthcare can learn a lot from other industries. Supply chain, we just had it. There's so much good things being done in supply chain that we can adapt. Again, for leadership, there's this wonderful article by Richard Boehme from HBS, or former HBS, now NAFLD Trials, on leading clinicians, clinicians leading, on saying we have medical doctors that are leading in their field, but they should also be able to lead in their departments, resources, strategy. How do we measure what we do and how do we change? So I think leadership is a crucial also in reorganizing and adapting now after COVID, reorganizing healthcare and really making us responding to the needs of patients.
Thank you, Magda. So, Timothy, 3 years ago, before pandemic, do you think that there is a significant change, the requirements for healthcare leadership post-pandemic, after the lessons learned from the pandemic as well?
Thank you, Magda. Now, I want to approach that question from my historical perspective. Now, over the years, a number of countries have had to initiate various reforms, whether it's institutional, financial, or service delivery. All these are meant to ensure that there is enhanced access to quality healthcare. But the most unfortunate thing is that the resources to be able to provide quality healthcare are scarce. And therefore, it becomes very imperative that necessary governance and stewardship is provided at various levels. Pick, for example, at one time, one country decided that all senior managers within the health service ecosystem must be medical doctors. Now, unfortunately, many of these did not have those leadership skills other than the technical skills. And therefore, there was need to train healthcare providers in the necessary leadership skills. And my university was one of those that took up that particular initiative. Unfortunately, as the first presenters of today did put it, at times the taps can run dry. And indeed, we are being sponsored by USID. The taps run dry. So what do? We need the necessary leaderships to be able to provide quality healthcare to the populace. So it is within this that as a university, we came up with an executive MBA program necessary to train leaders that are involved in healthcare provision. Unfortunately, we reached a point where the government decided that no, universities should not provide executive courses. So we had to move very fast and transform that into MBA Health and Leadership Management. It's one of the favorite courses among those who are involved in provision of healthcare. So leadership is very key for purposes of not managing the resources. And in this case, we're not just talking about the financial. We are looking at the physical, financial, and of course, the human resources. And therefore, leadership comes in handy. Thank you.
Thank you, Tim, for the wonderful insights. I share you totally about having the healthcare leaders from a medical background or non-medical background, because I believe that we need to change the culture in many communities that, for instance, in Egypt, I believe it's the same situation. We always look at the healthcare leader that they should come from a medical background. And we are encouraging in our program, we are offering in the executive education in AUC to accept all the administrators that have been working in the healthcare field for more than 3 years, even though with no medical background, to prepare them to be the leaders of tomorrow. So definitely, working on the culture is one of our main mission. I totally agree, and I'm backing you on this point. So, Magda, you mentioned about the innovation, which is now a mega trend in healthcare, and it has many forms. We are surrounded by telehealth, digital transformation, AI, driven technology everywhere. So how do you see the impact and the role of AI on healthcare. And what would be the challenges? I think the challenges, Timothy might talk about this in details because it has a financial issue, of course. But what about the role and impact of AI on healthcare?
Very good question. If I might just have one comment on earlier, you said medical leadership. I'm always, when I say that, I'm always told, don't forget the nurses. So yes, we have fantastic other professionals. I've seen great nursing leaders that really manage the whole operations of a hospital or of an institution. So I think very good to think about the other professionals as well with a medical or professional background, I would say. AI, well, AI, as we teach AI in the digital transformation in the business schools, we realize usually that we say it's not like, well, we have a department of AI in our company and the rest we do as usual. No, we know that AI will change the way that we manage industries, any industry, and it's not different in healthcare. Maybe in healthcare, what is a bit different is the whole GDPR issue, the data privacy, the should we share, should we not share? Patients or citizens, are they willing to share their data? Well, they do share them with Google and the Amazons of this world, no? And they rather like leave them. That should we leave it to those companies, or should there be some governmental responsibility for creating a safe environment where data can be collected and can also be used for research? I just come back from the Health System Research Conference in Bogota, and that was one of the issues that was discussed. What is the role of data? What is the role of AI and the digital transformation? I think what we need to realize is this change. It will substantially change the way that we provide healthcare, the way that we manage healthcare, and we rather will be thinking of ecosystems of these. It's no longer a transaction, but it's an interaction. Everyone is providing something into the system to get something out of it. And here we back to the multi-stakeholder, to the creating this ecosystem of creating something together that if we all contribute will be better. But that needs management, and it needs the capacity of people in order to understand this idea of ecosystem. And also by having good managers, that we, the public-private role or the public-private environment, can manage that and not leave it to companies that might have good intention, but maybe not always, like Google, Amazon, or the others.
Timothy, would you like to add something related to the challenges of implementation of AI in the healthcare?
Yeah, first, just to echo what my colleague has said, AI is very, very important for purposes of quick decision making. Today, especially in some part of Africa, Kenya being one of them, Eastern Africa, there is a lot of medical tourism to India. And part of the reason why this is the case could be attributed to inability to make quick diagnosis, because maybe we're lacking the necessary data and the likes. So there is need really to invest heavily and also train people to be able to use this. By their virtue of training, and you're a medical doctor, you understand, these are some of the skills that you may not have been taught in the medical school. And therefore the schools of business then comes in handy. So those are the deans and others who are here, colleagues. This is an area that we really need to take advantage of. There are quite a number of challenges that we face, and all these challenges, one, emanate from the rising population. Whereas the population, on this other hand, is increasing, GDP, on the other hand, is dropping. And therefore, resources available to finance provision of quality healthcare becomes a challenge. It is important that many countries in the world develop sustainable financing mechanism for healthcare. And that can be facilitated by you guys who are in the business schools. Come up with the models so that you can be able to advise. You are the people who are supposed to be doing cutting edge research that then can be used to make a decision. But some of this requires resources, which may not be available. There have been issues where the allocation of resources tend to be somehow skewed. Skewed in the sense that a lot is towards the financing of human resource and curative. But on the other hand, preventive, which is very key, becomes a challenge. Schools of business need to come in handy and be able to fill that void. The other issue is about managing human resource. It's a big problem. I wish to share this. At one point in 2018, all the medical doctors in Kenya were on strike for 100 days. So the health system almost collapsed. And one of the reasons why this was the case, the doctors through their union and the government, on the other hand, there was a problem of negotiation and lobbying. And therefore, business schools need to really come up with some of these courses, areas of lobbying and negotiation. Very critical. Financial management, planning and budgeting. These are key areas that are very critical. And COVID has taught us lessons. My colleague who came before, I think he's seated there, was talking about supply chain. For an efficient health system that provides quality care, then medical supplies and other technologies that are very critical come in handy. Unfortunately, in the medical schools, this is something that is not taught. And therefore, business schools, this is us who they need to play leading role. Thank you.
Thank you, Timothy, because you mentioned more than one point. I would like to expand discussion about this. Regarding the workforce, the labor market of the healthcare has been so stressed. WHO 2022 they declared that in 2016, they were expecting a shortage of the workforce in the healthcare field by 7 million. Yet now they are expecting a shortage of around 18 million by 2030. This is a huge problem. And we have to face it earlier as much as possible to contain the consequences. So you have a medical background, Magda.
Yes.
And in medical language, can you give us a recovery prescription for such a problem?
The prescription, that's good.
Recovery prescription?
Love to have that. Just to lay out this problem, that there were enormous effort and motivation by the workforce during the COVID time. And now we have a lot of breakdowns, overwork, mental problems that needs to be addressed. So it's a real problem, and real problem of motivating the workforce, and of maybe to see the right balance between what is the technology can do and what the workforce can do. I think we have to rethink the way, and here business schools can help. Another point that I would like to stress in terms of role of business schools is entrepreneurship. We have seen during the COVID crisis a lot of great ideas. I mean, there were people with great ideas who just made respirators out of 3D printers. And so they've just said, well, let's do it. And that's what we know in terms of management. Let's solve problems. And I think as educators, we should try to see how can we support the workforce, how we can support professionals and doctors to have a more innovative and entrepreneurial spirit in order to take responsibility of solving issues, and not just sitting there and saying, oh, well, I'm not paid well and my work is not good. What can I do about it? And I think here as business schools, particularly entrepreneurship, and then also the extending that a bit towards the startups. I know particularly in Kenya, we have a lot of great small startups around digital transformation. It's partly driven by doctors, that we can help bringing that into the real here, but at IESE, we have the BTT, the Barcelona Tech Transfer, where we have also some doctors that we match our MBA students with the doctors in one course where they have to work together on a business plan, supporting them. And I think that's another great role that we can do as business schools.
For sure, Magda. And, you know, burning out has been a common terminology in the healthcare field, specifically after Corona, and definitely to try to solve the expected mega problem by 2030. I think that the process should be starting from hiring, and then while they are during work, by training and retaining techniques. And the healthcare leaders has a very important role in this by listening and learning, brainstorming, showing sympathy and empathy for their employees, sharing them, and being so motivated to engage them in training programs and to enhance their careers, and all the way to retain them and to feel them that they made a good choice by choosing this career, because this is another problem where for the healthcare professionals, specifically during Corona or COVID and after COVID, a lot of healthcare workers has been going for career shift, or they don't believe in their work, they don't believe in their career because of too many challenges they have been exposed to all through the crisis. So, yes, please.
One or two things.
Please.
Yeah. Managing the human resource in the health sector has been an issue. And yes, those who are in that field have from time to time expressed their frustration, burnout, and the likes. And what comes in handy, and this is where the schools of business could play a key role, is two things. One, enhancing private-public partnerships. This, in a way, will facilitate sorting out some of these things. For instance, there could be a medical school that would wish to train as many as possible, but they may not be having the necessary facilities and the likes. Through public partnership, private-public partnership, it's a win-win situation. The medical school will benefit, the schools of business will benefit, and the community as a whole, including the government, will benefit. The problem I've seen is that some, and with the due respect, a number of those of us, especially the medical doctors, tend to be driven by other motives, which tends to contribute towards consumerism. And that really affects quite a number. Not forgetting the health financial catastrophes that are likely to be experienced. And therefore, schools of business, I think this is a good chance for us to be able to take advantage of this. It's not about setting up a facility and having the medical doctors. But one of the things, and where the capacity now comes in, is there enough economic appraisal to support why we are putting up this facility? Or should we do something else? And therefore, schools of business, you are better placed to facilitate in coming up with the necessary models that will guide the whole process. Thank you.
So I agree with you again that the concept and acknowledging of the role of School of Business should be shared with the undergrad. Years back, I had a meeting with one of the deans of the medical schools in Egypt, actually one of the biggest medical schools. And I offered him, even before I joined the School of Business, but by that time, I finished the diploma for hospital management and the quality management as well. So I offered him that why not to include a very short course for the undergrad to teach the undergrad the importance of quality and the importance of management as a part of the healthcare service, because the physicians or even the nurses, all the healthcare professionals, pharmacists or whatsoever, when they graduated, they thought that they only linked that I will write a prescription. This will be the final say for me with the patient. But they have to understand that they are within a context and they have to respect all the context, and because they are a part of a big process and they have to understand the importance of this process. And back to the consumerism, which is very important and interesting terminology nowadays, it's coming to the healthcare field, because the globe is going toward the patient design approach apart from the patient-centric one. The patient-centric approach, it's making the patient a passive. We are measuring and assessing the feedback of the patients and the families, but we are not engaging the patient from the beginning of the process. So the patient design approach is a creative concept, which is aiming for better consumer, coming from here, the consumerism terminology, better consumer experience and better outcome. And it's directly linked to the value-based healthcare. The value-based healthcare is a very important concept that should be embedded in all healthcare industry aspects, because it gives us the very complicated and difficult equation of having less cost with increasing the patient experience, and to have a positive impact across all their management process. So this is another point. And you mentioned the quality healthcare, Timothy, and again, quality healthcare is directly related to the value-based healthcare. And again, it links us to a personalized medicine approach. Personalized medicine approach needs the stakeholder collaboration, whether private and public, whether healthcare professionals, to have the healthcare related data availability, to have the buying in from the healthcare systems. And above all, we have to have this sustainable economic model to be able to implement the personalized medicine approach in the healthcare industry. So do you have a comment on this, please, Magda?
Yes,
I can see that you would like to add something. Please do.
Actually, you raise a lot of several important issues. One definitely is the triple aim, not the triple aim that the Institute of Health Improvement has been put on the way together with WHO. Better health, better patient experience, and this with the best use of available resources. And that's something as business school we can embrace, which is the basic for value-based healthcare. The second point you mentioned was that we really need to see it with medical faculties, how they can improve the managerial, entrepreneurial, digital transformation aspects in the undergraduate medical education. I worked with several universities across Europe with the medical school Kaunas, for example, very, very active medical students, and they really want that. So we sit down with them and say, well, how can we actually change that? Not so easy to really change the medical curriculum, because usually those that decide are of old school, no? So, and then the third point I'd like to make was common to you. There's this wonderful New York article already some time ago by New Yorker article by Atul Gawande, comparing the city in the US that spends the less per capita and spends the most per capita. And he said, I want to understand what's the difference. And he said it was the collaboration between medical doctors that then actually we have, you call it consumerism, no? When they collaborate then and we have a trust in the system, then actually we spend less and it's much more efficient. So here, I think as business school, we can also contribute in creating this trust environment that actually we have better collaboration between the different medical institutions and public-private partnership, as you said.
Timothy, I'd like to ask you a question. We mentioned the personalized medicine. We mentioned the role of business school. And we are always ensuring that we have to have a stable, sustainable economic models. So with this geopolitical tensions and economic instability and inequality everywhere, how do you see the healthcare can move forward?
Thank you. Indeed, like I did mention, especially in the developing countries, I happen to come from one of them. there was a massive tendency to rely on donor funding. But unfortunately, that is not sustainable. And there have been very many instances that have proved that we cannot over-rely on donor funding because, again, there could be some macroeconomic issues happening the other side, and therefore we affect, therefore money is reallocated and the likes. Or something could happen and you are told, oh, you need to impress this reform for us to be able to fund you. Then what happens? And it happened especially on patients who are on who are on ARVs. So what happens? So it is important, and this is where schools of business then come in. Facilitating in the development of sustainable financing mechanisms. Locally generated resources are the best. I'm an economist, and I'll tell you that if you struggle to raise money on your own as an individual, the way you spend that money is slightly different from the way you spend money that has come from nowhere. This is money that you never budgeted for. All of a sudden, I met Magda. Magda tells me, oh, now here, this is the case, we are giving you this money. But if you struggle and raise your own money, indeed, you'll ensure that even the usage will be appropriate. And therefore, other than us as business schools facilitating the development of such financing mechanism that are tailored on country basis, not universally accepted, because that may not work in Netherlands, might not necessarily work, for example, in Uganda, Tanzania, for instance. So that is very critical that we need to look at. The other issue I just want to digress a little bit on the value-based approach. Yes, it's about, yes, you are charging this patient, say $50 consultation fee. But does this translate into improved health outcomes? Schools or business, through our research institutes and the like, we come in handy to be able to facilitate this process. Issues of monitoring and evaluation. Fine. Heba has prescribed some medicine for me. I'm taking it, fine. But has that contributed towards, for example, improvement in disability adjusted life years? Quality improvement in life years or not? Who is capable of doing this? Schools of business. Again, COVID has taught us lessons. Some of us, we rely on tuition. But with COVID, a number of universities closed. So then what happened? This is an area that the schools of business, we need to take up and play a leading role. Another issue that I want to emphasize is about innovation and incubation centers for purposes of enhancing technology. Again, schools of business, we are better placed. In terms of coming up with cutting edge research that will then be used by various stakeholders, governments, providers of services and the likes, schools of business, we need to play a key role in this. Thank you.
Maybe just add on this, not only entrepreneurship, but also how will it change the way care is managed, the care process is managed with the technology. So that it's a key role.
I think this business schools has been already taking the step forward by moving from teaching driven toward research driven and now towards impact driven. And having an impact is very important, especially if all the work will be locally relevant. So definitely we will watch by eyes. So societal impact, which is very important for the communities and for business schools to be an active and a change and active agent in the community. And then they have to integrate sustainability in all core business skills teaching, because this is very important to be integrated and embedded, to be smoothly done. And it's not like a separate or standalone course of sustainability. This is a part of the day-to-day practice. And finally, we have to work on finding the metrics to measure this impact, because it's there and we know that it's there, but how we can measure this and how we can translate it into something that we can say, yes, we had put a fingerprint.
Yes.
Yeah.
Very good.
Do you still have any time left?
Actually, no, we don't. I apologize for that, but I know we got started late, but we're also anxious to get on with the break. And I know Heba, Timothy, Magda are committed to being here during the break
Yes, sure.
and to answer any questions
happy to
as
do
we
that.
go. But that
Yeah.
was wonderful. Thank you so much for.
Thank you. Thank you.
Thank you so much. We're gonna the break is open now. We're gonna truncate it a little bit, and we're gonna try to get started within about 5 minutes of the scheduled time for the final